Welcome to First Builders, the podcast for those who shape companies from the ground up. I'm Amber Illig, founder and general partner at the Council Capital, where we invest in early teams solving critical problems in essential industries.
And I'm Rachel Choi, partner at the Council. This podcast is about the people behind the playbooks, those who took a leap early and helped define companies before anyone knew their names.
And today's guest is someone whose entire career has been defined by bold moves and long-term vision.
We're joined by Dan Perez, co-founder and CEO of Hinge Health, the pioneering digital health company that recently IPO'd, making it one of the first venture-backed digital health IPOs in nearly 2 years.
And here's what makes this one especially exciting. Hinge Health reported nearly $400 million in annual recurring revenue in 2024. They support 20 million contracted lives and serve more than 2,000 enterprise customers, including many in the Fortune 500. It's one of the most significant exits in the musculoskeletal care space. Wow, that was a lot to say. And it started with a simple but radical idea that chronic pain treatment could go digital.
We'll explore what gave him the courage to walk away from both Oxford and Cambridge, and how he and his co-founder Gabriel Mecklenburg have maintained a strong partnership for over a decade, and what it really takes to scale a company like Hinge. Dan, welcome to First Builders.
Thanks for having me, Rachel.
Awesome. Well, before we dive too far into the origin story, I wanted to share something personal. So Dan and I actually met years ago in grad school, and we've been friends since then. And it's really been super incredible to just watch your journey throughout, making all those decisions to now leading this company at the forefront of digital health. It's just been an honor to really watch all of that. And then, knowing you personally, I know, of course, how much thought and intention probably went into that choice to leave your PhD program, after putting in all that time and effort and research. Take us back to that moment. What was going on through your head? Did it feel like a really big risk at a time? Or, did you feel confident that you were meant to build something different or do something different?
Well, thank you, Rachel. And thanks for having me. It's been great watching you as well move through your PhD into industry and now into venture capital. And, we both, started our PhDs around the same time. You left with a degree. I left with somewhat less than a degree. But I think we both learned a lot. But, my co-founder and I, we were actually doing our PhDs in the UK, and mine was partially in the US as well. And when we were considering our paths, we were in our late 20s at the time. For us, it was about using just a regret minimization framework. And I thought ahead to, my 80-year-old self and how to live my life so as to not have regrets. And I knew that if I dropped out of Oxford and founded a company at 80 years old, I wouldn't really be thinking to myself, oh gosh, I wish I would have finished that degree. I also knew that university had been there for 800 years before me, probably be there for 800 years after me. And so if I needed to go back, the option was somewhat there, but pursuing a startup idea, timing matters. And sometimes these moments in life don't come back to us again. And I also knew that if I stayed in school and missed that opportunity to found the company, and that when I was 80 years old, I would be thinking, what if? And so from that point of view, for me, the least risky decision was actually not founding the company. And so even in our darkest moments at Hinge, I never once thought to go back to my PhD. Not once. I thought of other things, I have a hard day of trying to grow revenue, particularly in healthcare, thinking to myself, why the hell did we do healthcare? We should have been crypto bros. Those sorts of things came to my mind. But those fantasies were only temporary moments of weakness. We feel very lucky to be in healthcare and have had the opportunity to build Hinge Health.
How did you start to see yourself as a founder? Because Rachel mentioned even throughout grad school, before you even took the plunge into Hinge, you were already very entrepreneurial. So was there, a moment or a shift where you started to see yourself as a founder rather than a physician or researcher?
It's a great question because I was always entrepreneurial when I was younger, and I liked to do things. I didn't see myself as an entrepreneur. I actually think the transition was somewhat forced upon me, but like a cold shower after the initial shock, it actually felt great. Because I actually started, even before grad school, I started in the medical school track. And I was actually in medical school. And let me tell you, if you're thinking about medical school, you could very easily plot out the next 20 years of your life. It's 4 years of college and maybe a year of research, then 4 years of medical school, maybe another year of research to, burnish that CV, and then a 5-year residency plus or minus 2-year fellowship. And at that point, you're 17, 18 years post high school and, 36 years old. But it's very set, and you can just plan out, here's the next 4 years of my life. I'm going to be living in this city, doing this job for this sort of certification, And then when I transitioned into the PhD route, things were a lot less guaranteed. As you know, when you're doing research, clinical research, and I was in biochemistry, and you're much more independent, and it's going to be up to you. And like, not everybody's going to go down the same track, right? If you're the top of your class in medical school, they call you a doctor. If you're the bottom of your class in medical school, they call you a doctor. But it's not the same way in a PhD. And so it actually was one of the healthiest things that happened to me, was switching from the medical school route to the clinical research or the wet lab research route, biochemical research, because it forced me to not have any more guaranteed expectations. I couldn't plan. I had to be much more comfortable with ambiguity. And to paraphrase Nietzsche a bit, you could take a handful of certainty or embrace a cartload of beautiful possibility. And once I started getting down the research route and realizing there's a lot of possibility in like building things yourself, I just kept pulling on that thread. And yeah, because PhDs are a lot less structured, I was able to pursue some extracurricular activities, as Rachel saw. So I was not a great PhD student, but it taught me the values of entrepreneurship, and like ran a few like student organizations and founded a few, and that it taught me how to hire people, build a team, bring enterprise revenue, deliver value to customers, and that was pretty addictive to me and my co-founder.
Yeah, I love it. Well, let's talk about the early days of Hinge Health. You and Gabriel started the company over a decade ago. What was the spark for that? And did you have a moment when you realized the idea really had, that real traction there?
Yeah, so it was actually our third company that we founded. So we founded a student organization that was never going to scale to $1 billion company, but it was actually, for up until recently, our most profitable organization that we ever founded.
Wow.
And then we founded a tech company called Marbler, which is trying to commercialize university IP, which was really good at collecting press and not so good at collecting revenue. And then Hinge was our third company that we founded. And really, we went back to our roots. We both have a personal history of musculoskeletal, and we both had received about 12 months of rehab when we were younger. And we loved our experience with our physical therapist when we were younger. But we felt that constantly going to the PT was actually quite onerous. It was actually quite costly, take time off work, take time off school. And we felt that technology could have delivered our care at a higher fidelity and a much higher convenience and higher level of personalization. And that was the inspiration around Hinge Health. And, we felt that if we could use technology to automate this small sliver of healthcare delivery, that over time, as technology continued to mature, we'd be able to widen the aperture and continue to automate more aspects of healthcare delivery itself. Because, healthcare is actually, despite all the technology you'll see in healthcare, it is remarkably manual. You're going to walk into a hospital, you will see all sorts of machines whirring and lights blinking, but most healthcare delivery itself is still often one-on-one with a provider or one with multiple providers. The technology is on the periphery often, but it isn't delivering the care itself. And there's a lot of reasons for that. There's a lot of unstructured physical tasks, reimbursement constraints, and we wanted to try to get this to work for PT. And our aim is to continue over time to just peel away more aspects of in-person care and use technology to deliver it more conveniently at a higher level of personalization, increase the quality and consistency of the outcomes. And that's the vision. So we've got a lot of work ahead of us, though.
Yeah. And fast forward to today, just off the heels of an IPO, what does your customer base look like, and how do they view Hinge Health and what you're able to do for them today?
Well, we're very lucky. Great question. We have, now over 2,300 enterprise customers. We had about 98% logo retention in 2024. And so about 20 million American adults now have access to our program. We're able to have really, really strong outcomes. And 50 plus health plans as health insurance companies, CPAs, and pharmacy benefit managers have selected us as their preferred or exclusive digital musculoskeletal partner, which we're really grateful for. And our customer base is really diverse. Like, we have folks in education, like universities, schools for elementary school, high school teachers. We have government agencies like nuclear power plants, like intelligence agencies using us for their employees. We have some of the largest tech companies, the top 10 tech companies several in the top 10 tech companies using us for their employees as well. And so, as well as now Medicare Advantage plans. And so we have a very diverse customer base from every conceivable industry. And so we've learned how to deliver rehab, exercise therapy to folks in a bunch of different settings. And it also shows you that orthopedic conditions, back joint muscle pain, it does not discriminate. It gets us all. White collar, blue collar. It is remarkably equal opportunity when it comes to impacting people's lives. But it's also very gratifying, because when you help somebody with their knee pain, suddenly they could bend down on the ground and play with their kids again, help somebody with their hip or back pain. They could go for a walk with their spouse after dinner, and it has such a big impact on the downstream areas of your health and the quality of your life. And so it's very gratifying for us.
Yeah, no, that's great. I mean, I love the diverse aspect of the customer base, because it really showcases like the increased access that you are providing, right? Like, again, when you were saying like equaling or leveling like that equal playing field, it's doing that on the customer side too, like giving them all that access. So the other question I had for you, were there moments when you thought this might not work, and how did you navigate those as you were building?
Yeah, there have been I'd say dozen plus moments when you're like, gosh, this is not going to work out. What the hell did we do? We've got to go move back in with my parents. And we'd always like to go back and like just think about what is actually going on here. And like we have overcome worse challenges in the past. And each time that we've overcome like one of these, key moments, it could have been, very early on, could we actually get a first customer? It took us like over a year, 15 months just to get a single customer to like raise their hand and say, I believe in you, I'm willing to take a chance. And after you've received dozens of no's and from investors and customers, you're thinking, are we actually onto something? What could be done? We persevered because we evolved the business model as we went. We moved forward the sales at the same time as we moved forward the product development, and we felt we were getting closer and closer and closer to the value prop that we needed to deliver. We started actually in post-operative care for musculoskeletal conditions, and we realized over time that there actually wasn't much of an ROI in giving people post-operative rehab, but the ROI was actually going earlier than surgery to actually prevent the surgery to begin with. And that came from a lot of customer conversations and understanding the space better, because me and my co-founder, we actually had post-operative rehab. That's what we knew best, and that's our point of view. And we realized actually most of the money spent is actually in chronic conditions like knee arthritis, hip arthritis, things that actually happen in people much older than us. But that was the biggest opportunity for impact, and so we kept getting more and more confidence over time that we could overcome some of these key challenges. And another key challenge over time was scale our care team. How do we actually raise venture capital to show investors that this will actually be a sustainable business long term? Could we actually navigate partnerships with some of the largest healthcare incumbents out there, particularly health insurance companies? And every single time we've met an existential crisis, it could be an oh shit moment, but we've developed a lot of confidence that if we tackle this soberly and chip away at it and break the problem down, we could eventually overcome this, and it's given us a lot of confidence over the years. And I encourage other startups or entrepreneurs to also try to step back and try to realize the problem for what it is. It's a few mini problems maybe, and tackle them one by one.
Yeah, and I love that you shared that it took a year to get the first customer, and that even this was your third business with your co-founder, because we see that all the time in our portfolio, and even with talking with other co-investors. Certain founders and investors think that if things aren't perfect and like accelerating right out of the gate, there's something wrong, but often it doesn't work out right out of the gate. So I appreciate you sharing that for any founders listening who might be going through it right now. But just
our Series A investor, I remember we were initially ranked, they probably had 30 investments at the time, and we were ranked like 29th as the second most likely to go bankrupt after 8 months in.
What a turnaround. That's awesome.
And I think we'll end up being their second or first or second best outcome now.
Wow.
So, it wasn't always obvious, but, we kept our heads down and we kept building.
That's awesome. And then you filed to go public in a market where most companies are waiting it out, both in digital health as well as in just the broader tech ecosystem. And not only that, you did it with real revenue, profitability, healthy gross margin, but just given the rarity right now, like how did you decide that this was the right moment to take Hinge public?
Look, great question. And for other entrepreneurs thinking about the making that plunge, you could be waiting forever for the perfect moment. Mm-hmm. And really it came down to our confidence in our product and the fundamentals of our business. And we've been planning this for a while. So it wasn't like a spur of the moment. We've been planning to go public and operating the business as a public company for many years. We made a great team in place. Our head of IR, Bianca, was hired here years ago to come in and whip us into shape so we could do this. The entire business kind of been rallied around this for the last few years, because if you're successful in the public markets, most of the time, not all the time, there are some weird bubbles that happen in the public markets, but it is a sign of a sustainable organization. Our vision is pretty bold. We want to transform outcomes, experience, and costs by using technology to scale and automate the delivery of care. that's just a vision statement if you cannot actually deliver on it and make it tangible, and it must be realized by a business that's going to have staying power. And we had to build a sustainable foundation. So, our product, it can now automate 95% of human clinician hours associated with PT, and it's, delivering really great value for the end user, that is the patient with back, joint, or muscle pain, and a real ROI for our customers. And then, could we actually have the go-to-market mechanics that, you not just build a product, but in healthcare, you got to get paid for it. And, we show that we have a repeatable go-to-market motion, and then getting the cost structure right. And I tell you what, once you are public, you have to open up your books. You have to be much more transparent, both with your employees, with your investors, and your customers. And we're seeing a lot more customer interest in us now that we're public, because we have that level of transparency. They know that we're going to be around and be a long-term partner. Look, with regards as well to the uncertainty, once you're public, you just can't unpublic yourself. So you're going to have to deal with this uncertainty, right?
True.
We had to navigate the tariffs, on our way to IPO just to get investor interest, ramps up again, or something else happens, geopolitical things happen, or interest rates rise, or a recession. Public companies just have to deal with it, and you're going to have to learn how to take the punches and still continue on with your business. And I'd say the markets are always open for good companies. And lucky for us as well, we weren't raising primary capital. By the time we went free cash flow positive for 4 straight quarters, and we weren't putting any money on our balance sheet, so it was all secondary, synthetic secondary. But I would say going public when you're free cash flow positive, it changes the tone of the investor conversations. We didn't have a lot of investors asking us around, are you still going to be around? Will this ever be a sustainable business? Because we had already delivered 4 straight quarters of free cash flow consistently, and it was growing. A lot of the questions were, how high could you take it? How profitable could the business become? And because we believe it's a sustainable org, let's talk about your roadmap. Let's talk about other things. And investor meetings, maybe in the years beforehand, were not focused on those things. They were focused on, will you actually be a sustainable org? You're still losing a lot of money. And so that would be, when it comes to timing, I would think less external timing and more internal. Have you shown that your business could be sustainable, and what is going to take for your business to be sustainable? If it's sustainable, there's not much on the macro that should give you pause towards going public.
Yeah, that's great. I love kind of the perspective on that. And it's similar to, I feel like sometimes people always say waiting for the right time for something, and there's just not always going to be that perfect time. Yeah, exactly. So let's talk about your co-founder relationship. I remember Gabriel also back in the OBR days in grad school, but you and Gabriel have been building together for over a decade. That's practically a lifetime, right, in startup years. So what helped that relationship last, and what advice would you give to other founders that are really trying to find that right person to build with?
I've said this before, I'll say it again. If you are an energetic American entrepreneur, you got to get yourself a German co-founder. It's
very specific.
One of the best things you can do for yourself. So Gabe has been phenomenal co-founder, phenomenal friend as well. And look, our relationship has been built on trust over time, and just getting to know each other, and knowing that we both care about solving the problem and getting better individually as well. And you want to get a co-founder you can be honest with when things get tough, and who's willing to roll up their sleeves, and who will get better themselves. Because you as a founder, you're going to have to scale yourself, and your co-founder's going to have to scale themselves as well. And you're both going to have to be able to look back a year from now, 2 years from now, 3 years from now, and both have made significant leaps. And me and Gabe, we grew up together. I was a little older. I was probably 26 when we met with our first company, and he was 24. And fast forward, actually, it's been 14 years we've been working together, but and about 10 on, a little over 10 on Hinge. And he was actually the best man at my wedding, one of my best men at my wedding. I'm the godfather for his first kid. I love this guy like a brother, but we've pretty much grown up together. I'm now 40, not 26 anymore. And he's, 37, 38. And we still do dinner once a week. I just actually confirmed our date night for Wednesday. And I think that's also really helpful for co-founder relationships to continue to meet. Before we had kids, we would meet on Saturday morning for 3 or 4 hours. And since we had kids, sometimes Saturday's a bit harder to meet up, but we'll still try to meet up at least once a week for dinner, and just talk about things, talk about life, talk about, relationships, certainly talk about the company and how things are trending. And getting that time, out of the office really helps, just to stick around. We'll still go on hikes together. We'll still go on trips together. And I think it's sad when co-founder relationships do break down. And we've had tense moments, like any relationship, over 14, 15 years. But we've always been able to rebuild from them. And and make sure that we trust that the other person has good intent. And I think some co-founder relationships, particularly when the companies fail, and we've had 2 companies fail, they break down to like recriminations and this and that. Every time something didn't work out, we got back to the drawing board, and never once did we think, okay, we got to move on with another thing, or heaven forbid, go to McKinsey or something. We stuck together, and we got a little bit better over time, and that's been one of the most gratifying aspects of building a business is doing it with Gabe.
That's awesome. Yeah, they always say, I find it to be true, like a co-founder relationship is just as high stakes, if not more, than a marriage, and it takes actual work to make sure it's going to, remain sustainable like that. So it's great to see you guys proactively put in the work. The other thing I wanted to ask is, you've also scaled Hinge through multiple inflection points. I'm sure there've been some times where you look around you and you don't even recognize the company that you're looking at because it's so different than 6 months ago. From team expansion to product evolution, go-to-market shifts, what was one internal bet that you made that really paid off?
Gosh, it's hard to think of just one. There's been a couple, and I think when you're building a product in like a new category that's growing, you're gonna have to make a couple of strategic moves, because there's quite a few, not just on product, but you might have to rethink distribution, because you have to think there's no predicate examples for distribution, or how are you going to market this and such. So I think about a few. First of all, it's channel partnerships. We invested in our health plan relationships much earlier than I think most others in our space did. We saw a few exemplary examples, Livongo and Omada kind of started, but then we went really, really deep, and I'd like to think we have the deepest health plan partnerships and integrations than not just anybody in digital musculoskeletal care, but I think anybody within digital health, period. And that's had been an incredible moat for our business. Other key moat has been our product moats. We launched a hardware device. A lot of tech companies stick to software, and there's a reason you stick to software, because hardware is hard. But we launched a hardware product, a proprietary electrical nerve stimulation device, and it was not something our clients were asking for. Not a single client asked us for this product, and that's okay, because customers cannot tell you how to surprise them. And we knew this would improve outcomes, and that it would improve the member experience. And after millions and millions that we invested in the technology, it has become one of the most delightful aspects of our program. It gives members a technology alternative to opiates or pain pills. Another key aspect of our product was computer vision. We actually wrote, 5 years before we entered the space in our Series A memo to our investors, that eventually we'll have to move to computer vision and away from wearable sensors. And, computer vision is a subfield of AI, and human pose estimation is a subfield of computer vision. And what was holding us back was edge compute. We knew that, if we were to do the compute, and computer vision is very computationally intensive in the cloud, there would be, a lag, a delay. And so we were kind of waiting, for 5 years. When will edge compute get to the point where we could transition our technology over here? And then we decided to make the leap about 18 months before we felt that the world was ready, knowing that it would take us about 18 months, 24 months just to develop it. And by then we were hoping that the world would catch up, and it did. And then the computer vision was ready to go. It had a phenomenal impact on our member experience. Now we could track 100 unique landmarks on your body using just a front-facing camera on your phone. And two-dimensional computer vision is pretty computationally intensive. We use three-dimensional computer vision. So just us, Apple, and Google were the three companies using 3D human pose estimation, and we could do it just on anybody's device, which is really exciting. Our competitors still haven't been able to quite leap to 3D, and they still have to send a tablet to people to get them to use their technology. And so we're really excited about some of these key product moves we made. And the last thing I would encourage digital health companies to do is validate their outcomes. We've been publishing and validating our outcomes for a long time, and certainly me and my co-founder, we published a lot more outside of our PhDs than in our PhDs. But that's been really key. So I would say the inflection points, think about distribution, and our channel partnerships has been a key entry barrier. Think about product moats, and don't just do things that others are doing out in the market. Be willing to do something different, and that's had a big impact on us. And then in somewhat unique to healthcare, you're going to have to validate your outcomes and start early.
Yeah, I love that. So the other thing also that I read when the IPO announcement came out, it was actually the Bessemer's IPO announcement. They said something that really stood out to me. They said that Hinge didn't just digitize care, it redesigned it. So I'm curious, from your perspective, what does that mean to you in practice? And how do you think you're going to keep ensuring that the company stays true to that kind of innovation as you scale?
That's a great question, Rachel. To us, we're not simply, by not just digitizing care, redesigning it, it means we're not just simply taking existing processes and just putting them online. We're imagining reimagining how care should be delivered if we started with today's technology as a foundation. And so we're not digitizing the status quo, we're trying to reset it. In fact, even last week, so we announced our latest product that actually builds upon this, because while I firmly believe we're moving towards a future that where more and more aspects of healthcare will be automated, and we've made significant progress, and others have also made significant progress. Most areas of healthcare today still require face-to-face interactions like surgery, imaging, injections. And to be clinically complete, we're actually creating a network of high-quality in-person providers across PT, imaging, and orthopedic specialists, such that now whatever our technology cannot automate, we can send to in-person care. And that's part of redesigning care, and that, we're not just saying you either come to digital health or you go to in-person care. We're trying to unify the care between the two, and that's not been something a lot of digital health companies have done. And we're really excited about this. That's one area of redesigning care, as well as using our software and connected hardware to still peel away aspects of in-person care and automating as much as we can. And that's something that just hasn't really existed before Hinge came along.
Yeah, when I hear you talk about that, it's really about that integration piece, right? Like using technology to augment and not just say that, oh, it's only one or the other. Because of course, patient care there is going to be a personal, in-person component to it. And that will be needed as well. So I like that integration piece in the care delivery.
Yeah, and it's also intellectually honest. The fact is, we've been able to automate a big chunk of outpatient physical therapy. And physical therapy is 1.2% of total, healthcare spend roughly, which is a big chunk. It's $50+ billion in the US. The fact is that there are many aspects of healthcare that can't be automated yet or delivered by software and connected hardware. And that just, if you want to deliver an end-to-end musculoskeletal care episode, it might involve imaging. It might involve, a steroid injection. It might involve an in-person evaluation. And some aspects could be delivered at home via technology. And so being intellectually honest, what can be delivered via technology today and automated, and what still requires in-person care. Maybe 200 years from now, it will all be delivered by software and connected hardware, but it's not today.
Yep. So switching gears a little bit here, what's a belief about healthcare or startups that you think most founders get wrong?
I'd say, that you could move fast and break things, like in consumer tech. In healthcare, you could move fast.
Especially in healthcare.
Yeah, exactly. You need to try to move fast or you're going to go bankrupt, but you have to deliver real outcomes along the way. And if you don't, you won't last. And there's been a lot of flashes in the pan or shooting stars that seemed really cool up front, but they didn't deliver lasting outcomes. And the second thing that I think a lot of digital health founders get wrong is you've got to move the product and the go-to-market aspects of the business together at the same time. Because the biggest barrier to innovation in healthcare is actually reimbursement. You're going to have to crack. There's a lot of healthcare innovators coming out of PhD programs, coming out of medical school, who have a passion for health or technology and could maybe improve outcomes, maybe build something that people want to use, but they haven't been able to figure out who's going to pay for it. And yes, there are consumer healthcare companies out there. We're not one of them. I think, my bias is that other than toothpaste and cosmetics, people expect their health insurance to kick in for their healthcare. And so you're going to have to figure out how to crack healthcare reimbursement along with building your product. And you got to get them both moving forward at the same time. And that's what we did from, basically 2 months in after we had our prototype. We were figuring out how are we going to sell this as well.
Yeah. And then on the flip side, is there anything that you wish more investors understood about health tech companies?
It's going to take a while. I think a lot of investors sometimes look at some of their consumer companies and think that, a healthcare company will scale like that. It can. Once you get your go-to-market, actually healthcare, because of the entry barriers, you could actually have a really, really good return on invested capital within healthcare. And your CAC could actually be a lot more efficient in healthcare as well, because you could have a bit of a captive audience. But you've got to understand that it's in healthcare, you're going to have to understand how the money flows. And it's not just about, the consumer paying for it. Some of the worst advice I got from investors was, just take it direct to consumer. And I'm so happy we did not take that investment. I got a lot of bad advice from investors along the way. That was maybe a top 5 bad advice that I ignored. Even as a young person, I ignored that because I knew that was bad advice.
That's good. It's a good thing you did. Clearly it paid off.
Yeah. And for anybody who doesn't know this acronym, MSK is musculoskeletal, which I'm struggling with. But anyways, you've helped bring MSK care into the mainstream for employers and patients alike. What have you learned about behavior change, especially in healthcare?
Well, healthcare is the baseline experience for a lot of us in healthcare is actually quite frustrating. Most of the time that we have in the healthcare episode is not with a provider. It's often with billing departments, reception desks, booking appointments, sitting in traffic, finding a parking spot. It's actually could be quite frustrating. And, the more you could make it easy and intuitive, the more people's stress reduces. People don't often want to think about their health. They actually just want to live their lives. And so make it easy, because you're not just competing with other healthcare companies, right? Why should I focus on my back pain versus my hypertension or my mental health today? You're competing with Netflix or Instagram, or for people to spend their time. And for a lot of us in healthcare, we're sometimes getting people to do something that they don't really want to do. Like for us, from a musculoskeletal care company, we're focused on people with back, joint, and muscle pain. And I'm trying to get you to do something, like move your painful knee. And that's something you just don't want to do right now. But I know if you move your painful knee, it might hurt in the short term, but long term, you're going to feel better, and your mobility is going to improve. So, make it simple and intuitive. And then secondly, help people score early wins. And so they have that confidence that, hey, this is working. I'm getting better. Because that could be incredibly motivating for people if they feel like they're making progress and they're taking more control of their health. And lastly, the more personalized you can make it, the better. And that's one of the promises of digital health, in that you can make things a lot more personalized for people, their experience, their overall care plan, etc., versus maybe in-person care, which might not adjust as frequently as digital care can.
Yeah, absolutely. And you kind of touched on this earlier, actually, where there's lots of other digital health companies. It's a pretty crowded space now with lots of different, I think, like focuses, whether musculoskeletal or something else, mental health, behavioral health, things like that. What do you think really helped like Hinge Health stand out, not just in the product, but also in the brand?
Really good question, because look, I would not want to found a digital health company today. There is so much folks that have been launching, like the barrier to entry is almost, 4 to 5 times higher, I think, than when we launched Hinge in October of 2014. And so I do not envy the seed stage, Series A stage digital health companies of today. But, a few things that have been very remunerative for us is focusing on being the best product on the market, the most validated, and the easiest to buy. And that intersection has been very, very remunerative for us. So firstly, the being the best product on the market. We try to be the most comprehensive and effective, and being very intellectually honest of what will it take to move these outcomes. When we speak to benefits leaders, they are in charge of a big budget, and you might trick a customer here or there. I see, some startups that don't have great products, even outside of MSK, get to 10, 20 customers, then they're going to get wobbly because they don't really have outcomes, and they're going to fall down. And we never wanted to be that. We never wanted to be a flash in the pan. We always wanted our product, the end user experience, to drive real outcomes, both clinical outcomes and financial outcomes, and being like delightful for members to use, have a really good NPS. And even today, our product remains, we estimate we have much higher engagement on our product than anybody else in our space, higher NPS. And last year, our usage on a per member basis was up 40% year over year. And so really, we're not done yet. We're constantly improving the members' engagements, the members' experience, so that they're using it more than ever. Secondly, constantly validate your outcomes. We published about 19 studies, several with tier 1 institutions like Stanford, Vanderbilt, University of Texas, University of Washington, and that's been really, really important to us to be able to demonstrate to our customers that our product works, both really good clinical outcomes and good financial savings. And thirdly, again, healthcare sold via channels. A benefits team might have 2 to 3 folks on their team. And if you're doing an enterprise sale, whether it's SaaS business or healthcare business, IT security business, you name it, you are not just selling to a company, you're selling to a person at that company. And how do you, empathize with what is it going to take for them to bring this through and implement it? They're going to have to take it through security and IT security review, legal review. They're going to have to think about, how do we roll this out to, our employees? And for healthcare, it's not just the employees, it's the dependents on the plan. So it's not just, a piece of accounting software that'll be used by the 20 accountants on the team. Yeah. It is like everybody on the team and their wives and, kids who are over 18. And so it's the risk is a little higher. And we really thought about how do we make it easy to buy? So again, think about being the best product and never getting complacent because the product is never overdone, constantly validating your outcomes so the customers have confidence that you're going to improve the outcomes that matter, and then making yourself easy to buy. And for us, by having our channel partnerships with health plans, we've made ourselves really the easiest solution to buy, and that intersection has been really remunerative for us.
Awesome. And let's talk about leadership. What's been your biggest evolution as a CEO from those early days in 2014 to now post-IPO?
I think every leader's got to scale themselves. And so first of all, I still read, 2 to 4 books a month across business or philosophy or, even writing, and try to develop new skills for yourself as a leader. And that's really, really important. And it really compounds over time. Just to get, 5% better, that will compound phenomenally after, a year. You do that, 5% improvement after 12 to 15 months, you're twice as good in a given task. And if it's 5% better, you can increase the rate, 5% better every week, then you're going to really compound a lot. So one, you've got to see yourself as not just born as a great entrepreneur or get too cocky if you get early success with investors. Stay humble and realize that you have a lot of work to do in terms of just building out your skills. Second bit that I've evolved as leaders is to learn how best to lead at all levels. I think a lot of bad advice you get, especially from MBA programs. My gosh, this is terrible fucking advice from MBA programs. They tell you that, as you grow, you got to delegate and delegate and delegate. That's the sign of a great leader, is that, you're at some point, you're just the CEO just turning some knobs and setting vision in the room and talking to investors. That is utter bullshit. And so you can't do everything as a CEO, and particularly as the company continues to scale. But as a founder CEO, I try to stay ultra hands-on for the most critical aspects of the business. Mm-hmm. And that is really important. And sometimes people come in and they're shocked, hey, I'm a P3 designer. What do you mean I'm going to present my work to the CEO next week? And he wants to see me present my work for the next, few weeks, because you're building a critical part of the product, and I want to be close to that. And I'm going to care about the color of the buttons on this part of the product, how we're placing this and how it might fit with, something else that we're doing. And it's a sign of the importance of your work, but, CEOs should be in the details. You of course, you can't be overseeing every project, but be comfortable being able to zoom in and out. Some projects you're going to stay at 30,000 feet, but be capable of coming down to 3 feet or even 3 inches. And it's not just relevant for CEOs, it's relevant for executives. We have hired a lot of executives over the years who are incapable of doing real work anymore. They can only delegate. They cannot write their own memos. They cannot write their own PRDs. They cannot actually get in and do IC work. So it doesn't matter what type of leader you are, a sales leader, account manager like in client success, a marketing leader, engineering leader, a product manager, designer, operations leader, finance person. If you are a VP finance or senior director of finance or CFO, you got to be able to dive into an Excel and do some work yourself sometimes and turn this project around. If you're a head of design, you got to be able to say, you know what, team, leave the Figma with me, and I need to give you some feedback on this screen, and I actually want to spend a couple of hours to think through some conceptual designs myself as well, and at least just to maintain that ability to actually get your hands in the work. And of course, there might be 10 other projects you're just monitoring and giving benevolent neglect to. And when you're able to do that as well and go into the trenches, it's not micromanagement, it's management. And you develop a lot of respect for the team because you could be at their level as well instead of just at a high level, and you develop a better sense of the work that's being done and a better judgment. And so leading at all levels, and then lastly, probably managing people differently. And I wish I would have known this earlier, and I've evolved as a CEO, is that not everyone is the same, and so you shouldn't treat them the same. Don't assume that the management tactic that worked on one person will work on the next person, or that everybody's good at the same things. Everybody has unique superpowers, and when you position somebody, put them in the right position to flourish, where the thing that they're doing almost comes naturally, they do beautiful work. And I wish I would have known that earlier, and that it's okay that somebody might not be good at this task that I expect other people to do good at. They're good at other things, and find out what they're really good at. And if that fits with your org, you're going to get really good stuff coming out of them. And I probably learned that a bit later in my career.
Yeah, no, absolutely. Well, as you look ahead, what's your North Star? Not just for the company, but for how you want to lead in this new chapter.
Look, we have a bold vision at Hinge. We want to use technology to scale and automate the delivery of care. And I want our company to be stubbornly focused on delivering against that vision. And we have a real shot at reimagining the delivery of care, but it's going to take focus to make that happen. But what you're going to see over time is that we have our core product in digital physical therapy, and we want to continue to enhance this product as we capture more of the total physical therapy spend. But we want to use technology to continue to peel away aspects of in-person care, to use technology to, say, on a V1, scale and automate, away 60 to 70% of provider interactions, with confidence that by the time we get to version 3 or version 4, we could get to 80, 85, 90% plus of provider interactions could be scalably delivered by our technology. And not all areas of healthcare are amenable to technology automation today, but more and more are opening up to technology automation every day, and we're really excited. We're going to chew on this for 50 years.
That's awesome.
Amazing.
And I promise this is our last question, but you mentioned... Yeah, you mentioned reading 2 to 4 books a month, which is absolutely incredible to get 5% smarter at any given time. Are there maybe 1 to 3 books you could recommend to folks listening to this podcast?
Sure, let me actually pull up a list. I would say not only should you read books, you should actively read them. And what I mean active is that you're taking notes. And so instead of just passively reading it, I take notes and then I review my notes after, and I have like a running Notion doc where I will, once or twice a year, I will read my notes for all of the books that I've read. And that helps to reinforce some of the principles. And it's not just like business books. I read fiction. I read, I think you learn a lot about human nature from fiction, particularly, some of the books we read in high school that none of us really appreciated because it's wasted on high school students.
And it really is.
Gosh.
You
I feel like it sent me back.
Later. Like Dickens and Steinbeck. Steinbeck is like,
but they're so good.
Really understands. Yeah, they're incredible. And particularly books that have like stood the test of time. But books that I would recommend for some founders, one is actually Competition Demystified. This is a business book, and he basically talks about Porter's 5 forces, which I think a lot of us are familiar with. They weren't all created equal. And the most important force is actually entry barriers. And how could you as an entrepreneur over time discover what are your company's entry barriers? It might not always be obvious up front. And then once you identify what those entry barriers are, you need to invest in and reinforce them so that long-term your profits will not be competed away. And that is something that we've really invested in at Hinge Health. And we have 2 key entry barriers for our business. One is our channel partnerships, which we've really invested in and run up the score and take very, very seriously. And the other is our product, working on roadmap items that we believe is sometimes 3-4 years ahead others in our space are working on. And you're gonna have to find out for yourself what are your unique entry barriers, and it might not be obvious for you in the first 3 or 4 years of your business. They might reveal themselves over time, but it's really, really important. And I found this book to be fascinating in that technology is not always the entry barrier, right? And there's been many examples in history where somebody with really cool technology still gets their profits competed away because other people are able to approximate that technology, and that wasn't really an entry barrier. So Competition Demystified was one key book that I encourage a lot of folks to read. Another one is High Output Management. I try to read that every now and then. It's an excellent book. It was written by the former founder of Intel, Andy Grove, and I read that early on in my career and continue to try to read it. Probably read it 3 or 4 times. Maybe a third book particularly for healthcare entrepreneurs is The Innovator's Prescription. So it's written by Clayton Christensen, who wrote Innovator's Dilemma. It's a thick book. I've also read it about 3 times. And the first time you're not going to capture everything. You'll capture the broad contours. The second time you'll capture quite a bit more. And then the third time it really started to crystallize for me. And that's been really important. It's required reading at the senior leadership team level at Hinge Health. Me and my chief medical officer, we always riff on some of the concepts. I agree with about 85-90% of it, and it's a fascinating book. But it does underline that the biggest barrier to innovation in healthcare is reimbursement. If you can't figure out how to get your product paid for, you're going to really struggle to build a health technology company because it could be quite rigid how you unlock payments for your product. And I have found after 10 plus years in digital health, a lot of healthcare veterans, even who work for health insurance companies, don't really understand the concepts of healthcare reimbursement, like the real nuances of how to make this work, and how the money moves through providers and health plans and employers and high deductible health plans. Like, it's actually quite nuanced. But once you figure it out, the fog somewhat dissipates, and you can plot out your business strategy much more effortlessly. So those are 3 books I recommend.
It's awesome. Thanks so much for sharing those with us. I'm excited to add them to my list.
Yeah.
Thank you.
Awesome.
And we're grateful. Appreciate the time, and hope that was useful for you.
Yes. No, this was so great. Thanks so much for being here. I know you're super busy. Where can people follow you or learn more about Hinge Health?
They can find me on LinkedIn. They could find me on Twitter as well. I'm not as active there, but they could find me both of those, and they're always welcome to drop me an email as well.
That's great. Well, thank you so much. Yeah.
Thank you, ladies. I appreciate it.
That was such a great conversation. I was so glad that we were able to get Dan on the podcast. Amber, what stood out to you from this conversation?
Yeah, I mean, one thing I mentioned during the podcast, but just want to, nail down at the end is really like this wasn't always a success story. This was his third company with his co-founder. It took them a year to get their first customer. And I definitely know founders and investors that would feel like, oh my gosh, is this even worth it at this point? It's taking way too long. And it was amazing to hear that he knew that even for one of his investors, he was being stack ranked in their portfolio, and Hinge was number 28 out of 30. And now fast forward to today, and they're one of the top 1 to 2 performers in that portfolio. I thought that was really telling because, even at the council, we talk about this all the time, Rachel. We're really betting on the captain to guide the ship. It's not necessarily about, everything they've planned from day one going right, because we know that it won't. And so I just love how open and honest he was about that. And I love that comeback story. I thought it was amazing. And then the other thing that really stuck out to me a couple times in the conversation was that he is a CEO that is constantly looking ahead to what's next in the industry that he's in, as well as the broader ecosystem around it. So even that bet they made on hardware, it wasn't anybody asking them to do it. They just were kind of looking at where computer vision and other technology was going to intersect their business in 18 to 24 months, and they wanted to be ready when it was time. And I just thought that was so inspiring because you do see a lot of founders and investors in the startup space that can be very reactive to sort of the trend of the moment, whether that's crypto, Web3, AI. Everybody's trying to rebrand themselves in, that moment. And I think it's way more powerful to be building just something with hardcore utility and then also thinking ahead to whether that's 18 months or 5 years ahead, but really making some strategic bets. So I thought that was really inspiring.
Yeah, absolutely. And especially when you were talking about the intentionality around the IPO timing and everything like that, the thing that stuck out to me was just the fact that it's not about the external readiness, right? Because timing is never going to be perfect. Markets will change, as they will. And he was really focused on more the internal readiness of the company, because that's is what going to really matter, right? It's the intrinsic value that you're creating, out there from your company as well. And then the other thing that he mentioned that, I really loved was just how he thought about all of these things in parallel that actually make the company successful. You can't just focus on one key lever like product development or having that best product out there. It needs to be the product plus the go-to-market and distribution, right? And it has to be also with understanding the customer and the team. Everything has to really work in sync in order to have that success as a company.
Yeah, totally. It's like the legs of a stool. If one of them is broken, the thing is not going to stand up. So, or if you're only standing on one leg. So, yeah. Well, everyone, thank you so much for listening in. And if you enjoyed this episode, share it with a founder or someone you think is founder curious. Leave us a review and make sure that you subscribe to First Builders whenever you get a chance and wherever you get your podcasts.
Awesome. And you can also follow us at The Council Cap on LinkedIn and Twitter or X. And then be sure to subscribe to our newsletter as well on thecouncil.co for more insights from early operators.
Thanks for listening, and we'll see you next time.